Mental health. The number of people treated for mental illness in Korea has been increasing every year from about 2 million in 2019 to about 2.7 million in 2023. The reason why the number of mentally ill patients in Korea is increasing is that they have not made much effort at the national level, even though it is difficult to find a solution to mental illness. Moreover, Korea's own culture of competition and collectivism is closely related to mental illness. Koreans try too hard to adjust the conditions of success to others' eyes, such as entering a university in Seoul, getting a job at a famous corporation, and buying their own home in their 30s. Because of this, Koreans have already started competing with others since elementary school, and they try to fit their lives into the way others think of success, rather than thinking about what they like and what their values are. Therefore, compared to Western countries with favorable environments for autonomy and self-realization, Korea has a grim environment of unhappiness and collectivism, and as a result, many people are suffering mentally. In this situation, we need to carefully analyze what mental illness is and how to solve it. This will allow us to know our minds better and know how to cope well when the mind suffers. I'll tell you a lot about various mental illnesses. First of all, we cannot analyze all mental illnesses in the world. Different scholars have different opinions, but there is no disagreement that most existing mental illnesses range from 150 to 200. Even scholars cannot study all these mental illnesses, so they have tried to classify specific mental illnesses into groups using disease classification codes. Therefore, we will introduce only specific disease groups while introducing mental illnesses that are often found around us. First of all, the most commonly found group is mood disorders. Typical diseases belonging to mood disorders include depression and bipolar disorder. It is said that the number of people with these two diseases in Korea combined is over 1 million. The more common of the two diseases, as of 2023, is depression. In fact, the feeling of depression is a feeling that everyone experiences several times, so it is not very surprising that depression is common. However, there is a big difference between feeling depressed and having depression in general. If you suffer from a drop in mood and motivation for more than 2 weeks, do not usually have hobbies or interpersonal relationships, or are too difficult to maintain your social life, it can be said that you have depression beyond just feeling depressed. Depression is one of the most common diseases, but the moment you leave it unattended, it can lead to suicidal thoughts, so you need early treatment. On the other hand, bipolar disorder is a disease in which mania and depression are repeated alternately. Therefore, patients with bipolar disorder have the symptoms of depression patients intact, as well as the symptoms of mania patients. Typical symptoms of mania include excessive activity, excessive optimism, aggressive behavior, and impulsive tendencies, and in severe cases, hallucinations and delusions can be experienced. Then, a typical characteristic of bipolar patients is that they can fall into another extreme called depression in a moment. Of course, the time it takes for such a sudden change of mood varies from patient to patient, but extremely bipolar patients may think excessively a few minutes ago and then immediately become pessimistic and attempt suicide. Anxiety disorders are one of the disease groups as common as mood disorders. About 960,000 people in Korea are patients with anxiety disorders. There are a wide variety of anxiety disorders, but in common, they worry about what will happen in the future or imagine the worst, and have symptoms such as restlessness and dizziness. With this in mind, let's find out about 2 typical types of anxiety disorders. First of all, social anxiety disorder is a disease commonly called social phobia, and you feel severe anxiety in various social situations and when you are focused on others. You don't just fear that others will harm you, but you feel severe anxiety when you are in a gathering of people or when others are in a situation where you judge you, even though you know that you have no reason to do so. Therefore, patients with social anxiety disorders are often afraid to go to places where there are many people. On the other hand, panic disorder refers to an extreme anxiety attack that occurs out of the blue. When a panic attack occurs, it feels like your breath will stop and your heart will stop, so patients with panic disorder often feel anxious that they will die when they are in this situation. Panic disorder and social anxiety disorder look similar, but they are different. This is because panic disorder suddenly occurs through panic attacks regardless of a specific context, and social anxiety disorder occurs while feeling fear in a specific context where others are interested. However, these two also occur together. In fact, this is the case with all mental illnesses. It is possible to have multiple diseases, such as complications. For example, if a patient with social anxiety disorder gets anxious in a place where he or she may feel anxious and has a panic attack, the person can be considered to have both anxiety disorders. Neurodevelopmental disorders are caused by defects in the brain and other body organs related to the nerves. The number of patients with neurodevelopmental disorders has been increasing rapidly in recent years, because ADHD, one of the types of neurodevelopmental disorders, has become a common disease in recent years. ADHD, called attention deficit hyperactivity disorder, has symptoms of carelessness and disorganized behavior. For example, it shows behavior such as not being able to stay still or not listening to others until the work is completed, and frequently losing things. ADHD is classified as a neurodevelopmental disorder, so it is characterized by various behavioral problems that do not coincide with age or developmental stage and appear immature, and it has been widely observed in children in the early stages, but it can sometimes lead to adulthood, which can occur at all ages. Meanwhile, autism stress disorder, another type of disease in neurodevelopmental disorders, shows symptoms of social communication and social interaction defects in various situations. Therefore, compared to other peers, they are often poor at human relationship skills and nonverbal expressions. They also have repetitive movements, such as repeatedly bouncing their fingers for no reason, and have excessive and limited interest in one unusual area. On the other hand, as the word spectrum indicates, autism spectrum disorder varies widely from patient to patient. Although there are no cognitive problems such as language delay, there are often high-functioning autism that has limited social interest and is difficult to interact with others, while there are also autism spectrum patients who have problems such as language delay or physical disability that require constant attention from specialists. Finally, schizophrenia spectrum disease groups are more common than expected. According to 2023 statistics, about 230,000 people in Korea suffer from schizophrenia spectrum disease. Like autism spectrum disorder, the degree of symptoms varies from patient to patient and can be classified into several subdiseases. Subdiseases include delusional disorder, schizophrenia, and brief psychotic disorder, and diseases belonging to the schizophrenia spectrum disease group have symptoms such as delusions, hallucinations, and broken accidents in common. In other words, if an accident is distorted or an object or sound that is normally processed in our eyes or ears looks or sounds strange, we can suspect a subdisease in the schizophrenia spectrum. On the other hand, to divide mild and severe levels according to the degree of schizophrenia spectrum, only delusional symptoms exist in the early stages, such as delusional disorders, and then short-term psychotic symptoms appear as short-term psychotic disorders, and finally, schizophrenia causes several symptoms of schizophrenia spectrum diseases such as delusions, hallucinations, and broken accidents, which can last for more than 6 months. First, the interaction of genetics and the environment in the human mind is what makes up the human mind. In other words, all mental illnesses have genetic and environmental acquired factors. If parents have a history of depression, their children are more likely to inherit it and develop depression than other children, and children who grow up in disadvantaged environments where their parents are alcoholics are more likely to develop various mental illnesses than children who grow up in environments where their parents are not alcoholics. Therefore, it is essential to take medication to prevent the imbalance of hormones in the brain, especially in situations where mental illness is getting worse. Otherwise, patients with mild depression can become more severe, develop severe depression or bipolar disorder, and patients with delusional disorders can develop schizophrenia. However, there is a premise that this solution should be done with a specialist. Then, is there any way to relieve mental illness by controlling my mind by myself? Of course, there is. I would like to introduce only a few of them. First of all, if you are a person who is not severely depressed, you need to do light exercise or do light outdoor activities while meeting someone you can trust. Otherwise, a hobby that can be done at home is good. This is because it is necessary to quickly escape from lethargy through this. Also, for patients with anxiety disorders, cognitive behavioral therapy, as known as CBT, is of great help. CBT refers to a treatment technique that identifies irrational thinking and changes emotion or behavior by reasonably changing it. Of course, it is implemented a lot in hospitals and clinical situations, but it is enough to do it on its own. For example, suppose that a heard people laughing in a psychology class presentation. So a thought that people were laughing at him. However, it may be inferred that people did not laugh at a because they thought of it differently, but that they just laughed because they were in a good mood today. Through this, you gain comfort in your mind and are exposed to similar situations again. If you are exposed in such a low-intensity situation that gives you anxiety, you will realize your distorted thinking, and you will gain the confidence to adapt well even in an increasingly high-intensity anxiety situation. Meanwhile, ADHD patients need to be trained to abstain and reduce smartphone use. Short and stimulating content, such as shorts and reels, repeatedly and frequently stimulates dopamine, one of the hormones. This excessive activation of dopamine can lead to problems such as addiction. Therefore, they tend to become addicted to faster, more stimulating, and distracting images, impeding concentration and worsening ADHD symptoms. Therefore, it is necessary to think of self-control methods such as setting the time to use the smartphone. Lastly, in the case of autistic spectrum patients, the severity of symptoms varies from patient to patient, but first of all, nonverbal behavior or conversation practice is necessary. It is also good to play a role play with a family, and it is important to learn why people do this and why they make these faces while watching videos of people talking. Most autistic spectrum patients are poor at social interaction and often do not know it at all, so they need to learn social communication as if they are learning how to solve a math problem. Thank you so much for watching.